One other item to highlight here is, as an ER doctor, there are a lot of things that happen that are emergencies, right?
Yeah.
In fact, an initial medical problem that could lead to, God forbid, a diagnosis of cancer or some other issue that leads to more and more procedures. Often they start with emergencies. And what do? You head to the local emergency department. Well, realistically, you're not going to roll into the emergency department and look at a price list, right? Because you're there, you're seeking help. But I think, I mean, a couple things here. You can do this right now is make sure the hospital that you are going to go to is in network. And if you do a little research beforehand, you can probably ensure you're going to get the best possible price. Because what happens to a lot of people is they'll go to an out-of-network hospital for an emergency or some other scenario that's more elective. And then they get hit with that bill, which is outrageously inflated, because the hospital knows that the insurance carrier has negotiated that bill down tenfold.
Yeah.
So you're going to get a bill for $70,000, $75,000 that, if you were in network, might be $5,000 after insurance pays their piece. Maybe less, maybe $1,000. But if you're out of network, there's a chance that you could be stuck with the whole thing. So a little research beforehand. But I'll finish all this with this one comment. If we make prices transparent, I don't think you're going to see as many scenarios where people go to a hospital with an emergency and they end up having a number of surgeries and a long hospital stay. I think we will limit the number of people that get home and have this sticker shock, because when there's transparency, market competition can help equalize some of those scenarios where people get these bills that are $500,000 or $600,000, and then they find out their insurance carrier doesn't pay for it. And I think this is the first step in that direction.
People have to be smart consumers about their health, just like everything else.
Yeah.
So in the meantime, just go through your X's and O's before there's an emergency. Find out who's in network, who's out of network, and ask questions. If you need to, you can find a patient advocate. A lot of them are out there to help make sure that none of these big numbers come across your desk. I'm still, FYI, a year and a half ago, over that is when I had my surgery. I still have bills show up that show date of service August 2017 for something, and I don't even know what it is.
Like pathology or x-ray studies?
It doesn't even say. It just says
unknown bills.
Services. I'm like, what? I paid all those. What is this? I don't know. Oh, I need a nap. I'm tired.